How is intrauterine insemination done? Intrauterine insemination or artificial insemination or IUI is a minor fertility or basic fertility treatment and is indicated only in a select group of patients. The procedure for insemination would be the fertility specialist may advise you either to do as part of a natural cycle or use certain medicines for ovulation induction. In terms of the success rates are usually better if used along with the ovulation induction agents. So if you are planning to undergo an insemination, first of all, you would need to be checked for the patency of the fallopian tubes. Both you and your partner would need to undergo an infection screen for HIV, hepatitis B, hepatitis C, chlamydia and rubella immunity. So these are some of the pre-treatment tests that needs to be done, and the patency of the tubes have to be confirmed. Once all this is in place, then if you're undergoing through an ovulation induction along with intrauterine insemination, you would take the pills such as Clomid or Clomiphene or gonadotropin injections. You will undergo the follicle tracking just like any other ovulation induction patients. Once you are coming close to the ovulation, or we are facilitating the ovulation by the use of certain medicine, then you would be given an appointment to come in for the IUI or insemination. On the morning of the planned insemination, your partner will produce a sperm sample which will be prepared and centrifuged, and healthy looking sperms will then be selected for instilling into the womb cavity. You will have to undergo a gynecological procedure which is very similar to performing a smear test. The selected semen fluid is then loaded up in a very fine plastic catheter, and after the cervix has been visualized, this catheter will be passed and placed within the womb cavity or the uterine cavity, and then the sperms are released. After that, you are then advised maybe to use some progesterone pessaries or suppositories to give extra supplements of the progesterone to help with the implantation, and you will then take a pregnancy test in 2 or 3 weeks time. And if the treatment is successful, you would then be booked for a pregnancy scan. If it is unsuccessful, then in that case you can proceed with a further insemination treatment. So whether there are certain clinical indications where we would recommend performing insemination before proceeding with the IVF, or there are situations where we clearly think we need to proceed with the IVF. So in the former situation where we need to consider doing insemination first, the patient profile where we would recommend doing insemination first would be where the female age is less than 30 or 35, they have been trying maybe only for 18 months, they're anxious and they want to consider certain treatments, then insemination may be a good starting point. The other subgroup of patients where we may recommend doing insemination first, where the patients are just not emotionally prepared to embark on the most complex treatment that has got its risks and complications and a lot of demand on the treatment. In those group of patients, again, we would recommend doing insemination. Clinically, where the female may have vaginismus or there is problem with erectile dysfunction, then again, insemination is a first starting point. IVF is clearly recommended in patients if there is failure of induction of ovulation despite using gonadotropin injections over multiple cycles, then reluctantly IVF may be the way forward in such group of patients. Also, in patients with moderate to severe tubal disease, where there is blockage of both the fallopian tubes or removal of both the fallopian tubes, then probably there is no other option but proceeding with an IVF treatment. And also where there is an involvement of a male factor in fertility, again IVF or ICSI would be clearly indicated. So these are some of the indications where there is a fair degree of clarity as to what procedures may be required, but in certain situations the clarity may not be as much. However, we can consider based on patients' informed decision.